you are allowed to fire your doctor. Once you turn 18 years old, you can go anywhere your insurance is accepted. Some medical professionals make it a career not to listen to their patients and only use them for their personal opinions. I had a gynecologist once that refused to listen to any of my concerns about pain, even though our family history is full of gynecological issues. I turned 20 and found a new doctor. Some doctors see women as numbers or just regular, she'll be okay, but not people. If you're a woman and you have had any kind of issue, went to a doctor, chances are you were told you need to lose weight or your diet was causing a problem. Some doctors do not listen. You may spend years looking for an answer for an issue that you have, and it's normal to want to take care of your health. I spent 15 years of my life on birth control. I was diagnosed with endometriosis, and birth control is said to help the symptoms. But before I was diagnosed, I was seeing a doctor who was just giving me medicine that basically was like a test tube or a test subject for her. She didn't think that I was telling her the truth because apparently children don't have pain. It's just regular periods. I don't know anything about it. She prescribed me a generic hormone pill, which is any generic birth control pill, and it was supposed to lessen the days of my cycles, which it did, but the pain was still there. About 3 months, I noticed that my moods were getting off and on and changing, so she prescribed me another birth control pill. She would write that I had dysmenorrhea on my charts after our appointment, and if you know what that is, that's just a blanket term for menstrual pain. Nothing on the pain that I was actually having. Dealing with this doctor for 6 years, my symptoms were getting worse and worse, and she kept skating around trying to diagnose me with something other than dysmenorrhea. I did my own research, trying to find out each and every medical term that could help me point in the direction of what the pain was, and I would give them to this doctor that I had. If you are like me, had to deal with a doctor like the one I'm describing, you understand that you become a master of Googling your symptoms and pains. Everything I found that was concerning my particular issue, it needed to have at least an ultrasound to look at my uterine area, and she didn't want to do that because again I was still too young to have pain like I was telling her. My blood tests were only reading that I was having my blood test that she did want to do was reading that I had low iron, and that's a sign of heavy bleeding, but that was still under the blanket term she gave me of dysmenorrhea. And when you're tired of getting ignored and you tend to take matters into your own hands, this doctor kept refusing treatment. Each month I would go back for more pain and more problems. My third point is when I got to the point where I was crawling to the bathroom because standing was too painful, I knew I had to take charge of my situation. In 2012, I had enough. Everything in my pelvic region will always hurt, no matter if I was on my cycle or not. Intercourse was painful. Using the bathroom was painful. Everything below my belly button hurt. I did a review with that doctor, and I made sure to say everything that she was and wasn't doing. I crawled around for the last time, and my cousin, she had just had a successful in vitro fertilization, and I called her to find out who she saw because she was diagnosed when she was, I think, 16 or 17 with polycystic ovarian syndrome, or PCOS. PCOS. And her doctor, who is currently my gynecologist right now, she referred me to her doctor, and I called him in an appointment because my insurance was accepted. I went over there and saw my new doctor, and for the first time I actually was just listened to. There was no cutting me off, telling me there was, oh, it's just your period, or everybody goes through this type of thing. No, she listened to me. She sat there writing things down like notes on her notepad, and I told her everything that I was going through, and she listened to me. And finally she said, I think you need an ultrasound. Oh, I never had that before. So we get ultrasound done. She thinks that I have endometriosis, and then she refers me to a fertility specialist, which happens to be her husband, and he then diagnosed me with endometriosis without the surgery, because if you have any type of pain and it looks like in your uterus there's these masses, I had adenomyosis as well, which is growing inside my uterus. You have control over your health. We have to use doctors to help us, of course, but you ultimately don't have to have that doctor if something is wrong, if they aren't trying to treat you. While it's irresponsible for doctors to not listen to our patients, it's our responsibility to take our symptoms into our own hands. If you feel something is wrong, keep trying to find relief. Keep trying to find relief. Don't give up on yourself. If you need to, report to doctors so that they can't treat another patient the same way. These people keep getting away with treating people the way that they think they should be treated, and it's not fair to people who need help. If you have anyone, if I have anybody who has any issues with their periods or they're having a baby, I will always recommend them to my doctor that I've seen because she is amazing. She listens to you. There's a whole office of them who will sit down and listen to you and just make sure everything is going the way it needs to go.